children, good morning to all. Welcome back to class 12 online economic class. We were discussing chapter 8 infrastructure. In the previous class we have discussed about one important infrastructure, that is energy. So today we will focus on another infrastructure, that is health. This is a social infrastructure which provide aids to human capital formation or human development. So let's start our section. First of all, what do you mean by health? Yes, the state of absence of disease, that is known as health. But health is not only absence of disease but also ability to realize one's potential. A person's well-being depends upon his health. So health is the holistic process to the overall growth and development of the nation. The health status of a country can be measured by mortality rate, life expectancy and nutrition level, etc. and also with the incidence of or spread of communicable and non-communicable diseases. Then what about health infrastructure? The development of health infrastructure ensures a country of health manpower for production of goods and services. So health infrastructure includes hospitals, doctors, nurses, paramedical professionals like pharmacists, lab technicians, then also bed equipment required in hospitals and a well-developed pharmaceutical industries. So these are included in health infrastructure. Then let us discuss the status of health in India. So government has the constitutional obligation to guide and regulate all health issues such as medical education, adulteration of food. Adulteration of food means adding up of artificial or chemical ingredients in food which are not good for our health. That is known as adulteration of food. Then also drugs and poisons. Then medical professionals. Then collect the statistic about state health status, etc. Then the union or the central government evolves broad policies and plans through Central Council of Health and Family Welfare. In India, since independence, there has been significant expansion in health services. So, according to the data, during 1951 to 2013, the number of government hospitals and dispensaries increased from 9,300 to 44,000 and hospital bed increased from 1.2 lakhs to 6.3 lakhs. The nursing personnel increased from 0.18 to 23.44 lakh and also allopathic doctor from 0.62 to 9.2 lakhs. Okay. So in India, government sector and also private sector plays an important role in health sector. So first of all, government sector. India's health infrastructure and healthcare is made up of a three-tier system. That are primary healthcare, secondary healthcare and tertiary healthcare. So first one, primary healthcare. So it includes or it provides education on prevailing health problems and method of identifying, preventing and controlling them. We know in today's coronavirus pandemic situation how our primary health are working. Okay. Then the maternal and child health care. It also provides maternal and child health care. Then immunization, that is vaccinations are given through primary health centers. So what do you mean by primary health centers? In order to provide primary health care, hospitals have been set up in villages and small towns. And they have a single doctor, a nurse and a limited quantity of medicine. That is known as PHCs, that is primary health centers or otherwise known as community health centers and sub-centers. Okay. Then primary healthcare provide essential drugs or tablets to the public at free cost. Then the second one, secondary healthcare. Healthcare institute having better facilities for surgery, X-ray, ECG are called secondary healthcare institute. government medical colleges and district hospitals, etc. So when the condition of a patient is not managed by PHCs, they are referred to here. They are referred to secondary healthcare institute. Then the next one, tertiary sector. So it includes many premier institutes which impart quality medical education and conduct research and also provide specialized healthcare. So in tertiary sector, there are the hospitals which have advanced level equipment and medicines and also undertake all the complicated health problems which could not be managed by primary and secondary hospitals. For example, All India Institute of Medical Science, New Delhi, Medical Education and Research, Pondicherry, etc. And also we have private healthcare sector. In private healthcare, we have more than 70% of hospitals and 60% of dispensaries, and they provide healthcare for 80% of outpatients and 46% of inpatients. So today it has been playing a dominant role in medical education and training, medical technology and diagnostic, then hospital construction and provision of medical services. So however, private sector in India has grown independently without any major regulations. So some private practitioners are not even registered doctors. Then also it is very expensive. Private sector healthcare is very expensive. So the government or the state has the main role in providing healthcare, still very important. So government services is very important as poor can depend only on government hospitals due to huge expenses in private healthcare services. Then also we have medical tourism. What is the medical tourism? It's a great opportunity in front of India today. That is, more foreigners coming to India for medical treatment. Indian doctors considered to be one of the best doctors in the world in terms of education, or quality of education, or in terms of intelligence, etc. But most of Indian doctors going abroad for better income and for better working conditions. So government have to develop medical tourism by providing more health infrastructure facilities. Okay. Then we are moving to the next topic, that is Indian System of Medicine or ISM. So it includes 6 systems. They are Ayurveda, Yoga, Unani, Siddha, Naturopathy and Homeopathy. So this system, alternative system of medicine is known as Ayush. Ayurveda, Yoga, Unani, Siddha, Naturopathy and Homeopathy is known as Ayush. So ISM or Indian System of Medicine has huge potential and can solve a large part of our healthcare problem because they are effective, they are safe, there is no side effects and also inexpensive. Next we are going to critically analyze the indicators of health and health infrastructure in India. So as we said earlier, the health status of a country measured through various indicators such as mortality rate, life expectancy, nutrition level and also incidence of communicable and non-communicable diseases. So according to data, India has about 70% of world population, but it bears 20% of global burden of diseases, GBD, golden burden of diseases. So what do you mean by golden burden of diseases or global burden of diseases? It is a indicator. It is an indicator to measure the number of people dying prematurely due to a particular diseases as well as the number of years spent by them in a state of disability owing to the diseases. That is known as global burden of diseases. Okay, GBD. So it is an indicator that measures the number of people dying prematurely or dying before their life expectancy due to a particular diseases, as well as the number of years spending by them in a state of disability owing to this diseases, that is known as GBD. So every year around 5 lakhs children die of waterborne diseases and also due to AIDS. Then malnutrition and inadequate supply of vaccination leads to the death of 2.2 million children every year. So at present, less than 20% of the population utilize public health facilities. Okay, only 20% of the population utilize public health care. Then rest of 80% utilize the private healthcare facility. Then also only 38% of PHCs, public primary healthcare centers, have required number of doctors, and only 30% of PHCs have sufficient stock of medicine. So this indicator shows a negative trend in India. Okay. Then next topic is urban, rural and poor rich divide. Okay, that is the difference in urban treatments in urban rural people and also for poor and rich people. So differences in medical healthcare between urban, rural and poor rich can understood from the point given below. They are people in rural areas do not have sufficient medical infrastructure. Only 1/5 of total hospitals are located in rural areas. Rural India has about half the number of dispensaries. Out of 7 lakh beds, then 11% are available in rural areas. This leads to differences in health status of people from urban to rural. Okay. Then there is only 0.36% hospital for every 1 lakh people in rural area, while urban areas has 3.6% hospital for the same number of people. Then the PHCs located in rural areas do not offer many of the facilities like X-ray, blood testing, etc. Even though 380 recognized medical college produce about 44,000 medical graduates every year, but still there is a shortage of doctors. Then 1/5 of these doctors migrated from our country to another countries for better job opportunity. Then also the poorest 20% of Indians living in both urban and rural areas spend 12% of their income on healthcare, while rich spend only 2%. Okay. Then also we have to study about the women health status in India. Women constitute about half the total population in India. They suffer many disadvantages as compared to men in associated with education, participation on economic activities and healthcare. So the sex ratio has been deteriorating from 927 in 2001 to 914 in 2011. So what do you mean by the child sex ratio? That means the number of female per 1000 male in the age group of 0 to 6. That is known as child sex ratio. So it is declining in India. So there is growing incidence of female feticide, okay, in the country. That means female feticide is illegally aborted on the reason that the fetus is girl. Okay. Then in the country, close to 3 lakh girls under age of 15 are not only married but already born children at least one. Then more than 50% of married women between the age of 15 and 49 years suffer from anemia caused by iron deficiency. So it has contributed to 19% of maternal death, and abortions are the major causes for maternal morbidity and mortality in India. So health is a vital public good and a basic human right. All citizens can get better health facilities if public health services are decentralized. Success in the long-term battle against diseases depends on education and efficient health infrastructure. It is therefore critical to create awareness on health and hygiene and provide efficient system. The role of telecom and IT services cannot be neglected in this process. The effectiveness of healthcare programs also rests on primary healthcare. The ultimate goal should be to help people move towards a better quality of life. So, that was today's section. With this topic, our 8th chapter gets finished. In this chapter, we have discussed about the meaning of infrastructure, then different kinds of infrastructure, and also two important infrastructures like energy and health. So, infrastructure, both economic and social, is essential for the development of a country. As a support system, it directly influences all economic activities by increasing the productivity of the factors of production and improving the quality of life. So, while assessing the two infrastructure, energy and health, it is clear that there is scope for equal access to infrastructure for all. Okay, students. So, I am going to wind up here. So, see you in the next class with a new chapter. Until then, bye.